Welcome to Health Systems of North Carolina Staff Training, protecting clients, honoring rights, and providing culturally responsive care. Part 1, HIPAA and 42 CFR Part 2, helping you live your dreams every day. Welcome and thank you for joining this training. My name is Dolores, and I will be your guide through Part 1 of this 3-part staff training series developed by Health Systems of North Carolina, PHSNC. At PHSNC, our mission is to provide person-centered, compassionate, and clinically sound behavioral health services that empower individuals and families to achieve stability, independence, recovery, and meaningful quality of life. Our vision is to build stronger families and healthier communities by meeting individuals where they are, helping them overcome systemic barriers, trauma, and unmet needs, and supporting long-term recovery, self-determination, and sustainable success. Everything we do at PHSNC flows from that commitment, including how we protect the people we serve. This training is designed for all PHSNC staff, including peer support specialists, qualified professionals, clinicians, administrative staff, supervisors, and organizational leadership. Regardless of your role, you have responsibilities under federal and state law to protect client information. And this training will help you understand exactly what that means in your day-to-day work. Part 1 focuses on 2 critical federal frameworks, the Health Insurance Portability and Accountability Act, commonly known as HIPAA, and 42 CFR Part 2, the federal regulation that provides special confidentiality protections for individuals seeking substance use disorder treatment. These are not just legal requirements, they are expressions of our respect for the people we serve. Learning objectives for Part 1. By the end of this training, you will be able to 1. Define protected health information, also known as PHI, and explain why it must be safeguarded under HIPAA. 2. Describe the minimum necessary standard and apply it in your daily work. 3. Distinguish between the uses and disclosures of PHI that require authorization and those that do not. 4. Explain the additional confidentiality protections provided by 42 CFR Part 2 for individuals receiving substance use disorder services. 5. Identify the prohibition on redisclosure and understand when and how consent is required under 42 CFR Part 2. 6. Apply PHSNC policy and supervisor guidance to protect client information in documentation, communication, and daily practice. Section 1, Understanding HIPAA, the Foundation of Privacy in Healthcare. HIPAA, the Health Insurance Portability and Accountability Act, was enacted by the United States Congress in 1996. It established a national standard for protecting the privacy and security of certain health information. For behavioral health providers like PHSNC, HIPAA is not optional. It is the law, and it governs how we collect, use, store, and share information about the people we serve. As a PHSNC staff member, you are what HIPAA calls a workforce member of a covered entity. That means these rules apply to you, every day, in every interaction. So what exactly does HIPAA protect? HIPAA protects what is called Protected Health Information, or PHI. PHI is any information that relates to an individual's past, present, or future physical or mental health condition, the provision of health care to that individual, or the payment for that health care, when that information can be used to identify the person. This includes names, addresses, phone numbers, dates of birth, social security numbers, medical record numbers, account numbers, diagnosis codes, treatment notes, photographs, and any other information that could identify a specific client. Here is a key principle to hold on to. If the information could identify who the client is and it relates to their health or treatment, it is PHI, and it must be protected. At PHSNC, we work with highly sensitive behavioral health information. Our clients share their struggles with mental illness, trauma, substance use, and crisis. That information is shared with us in trust. Protecting it is not just a compliance requirement, it is part of how we honor the dignity of every person we serve. Section 2, the minimum necessary standard. One of the most important principles in HIPAA is something called the minimum necessary standard. This standard requires that when you access, use, or share PHI, you only use the minimum amount of information necessary to accomplish the purpose at hand. In practical terms, this means do not access client records out of curiosity. Do not share more information than is needed. Do not discuss a client's history in a hallway conversation when it is not related to a current service need. Let's look at a PHSNC example. Imagine a staff member in the administrative office needs to verify that a client attended an appointment in order to process billing. The minimum necessary standard means that staff members should access only the scheduling and attendance record, not the clinical notes, not the treatment history, not anything beyond what is needed for that specific task. As a peer support specialist, you may work very closely with a client. You may know a great deal about their story. But HIPAA requires that you only access and share what is specifically needed for your role in supporting their services, nothing more. As a clinician or supervisor, you may have broader access to records, but that access comes with professional responsibility. Reviewing records beyond what is needed for a current treatment decision or supervision task is a potential HIPAA violation, even if you have good intentions. The minimum necessary standard is not about being unhelpful, it is about being purposeful. At PHSNC, we use information in service of the client, not beyond it. Section 3. Uses and disclosures of PHI when authorization is required. HIPAA allows certain uses and disclosures of PHI without the client's written authorization. These are called permitted uses and disclosures. They include using PHI for treatment, payment, and healthcare operations, commonly referred to as TPO. For example, sharing a client's diagnosis with a treating clinician is permitted. Submitting a billing claim to Medicaid is permitted. Using de-identified client data in a quality improvement review is also permitted. HIPAA also permits disclosure without authorization in specific situations, when required by law, when reporting suspected child abuse or neglect, when there is a serious and imminent threat to health or safety, or when responding to a valid law enforcement request under specific legal standards. However, for most other disclosures, especially those that are not related to treatment, payment, or operations, PHSNC must obtain written authorization from the client. This includes sharing information with family members, employers, schools, other providers not currently involved in care, attorneys, or any outside party. Authorization must be written, signed, and dated by the client. It must specify what information is to be shared, with whom, for what purpose, and when the authorization expires. The client must also receive a copy of the signed authorization. At PHSNC, our authorization for release of information form is the document you use for this purpose. Never share PHI based on a verbal request alone. When in doubt, stop, consult your supervisor, and follow PHSNC policy. Section 4, 42 CFR Part 2, Special Protections for Substance Use Disorder Records. Now let's turn to 42 CFR Part 2, one of the most important and most misunderstood federal regulations in behavioral health. 42 CFR Part 2 is a federal regulation that provides confidentiality protections specifically for records of patients who are treated in federally assisted substance use disorder programs. If PHSNC provides or receives funding for substance use disorder services, then 42 CFR Part 2 applies. Why does 42 CFR Part 2 exist? Because Congress recognized that individuals with substance use disorders face unique risks of stigma, discrimination, and legal consequences if their treatment records are disclosed without their consent. People are more likely to seek treatment if they trust that their records will be protected. And when people seek treatment, lives are saved. Here is what makes 42 CFR Part 2 different from standard HIPAA. HIPAA permits certain disclosures without authorization, such as for treatment, payment, and operations. Under 42 CFR Part 2, those same disclosures may require the client's written consent. The consent form must specifically name the person or organization receiving the information, the specific information to be disclosed, the purpose of the disclosure, and an expiration date. This means that even if another provider is treating the same client, PHSNC cannot share substance use disorder records with them without a signed consent, unless a specific exception applies. Exceptions to the consent requirement under 42 CFR Part 2 include medical emergencies, audit and evaluation by oversight bodies, reports of suspected child abuse or neglect where required by state law, and disclosures pursuant to a court order that meets specific legal standards. If you are ever uncertain whether a disclosure is permitted under 42 CFR Part 2, stop. Do not disclose. Consult your supervisor or PHSNC's compliance resources immediately. Section 5, the prohibition on redisclosure. One of the most critical protections under 42 CFR Part 2 is the prohibition on redisclosure. This means that when a person or organization receives substance use disorder records from PHSNC under a valid consent, they are prohibited from resharing that information with anyone else, unless the client has specifically authorized that additional disclosure. Every disclosure packet we send under 42 CFR Part 2 must include a written statement that says in substance, "This information has been disclosed to you from records protected by federal confidentiality rules. Federal rules prohibit you from making any further disclosure of this information unless further disclosure is expressly permitted by the written consent of the person to whom it pertains, or as otherwise permitted by 42 CFR Part 2. As a PHSNC staff member, you need to understand this for two reasons. First, you must include this statement when you share Part 2 records. Second, if you receive substance use disorder records from another provider, you may also be bound by this prohibition. You cannot redisclose those records without the client's consent. This applies to verbal disclosures as well. You cannot verbally share Part 2 protected information with an unauthorized party, even if you never provide a written document. At PHSNC, all releases involving substance use disorder treatment information must be reviewed for compliance with both HIPAA and 42 CFR Part 2. If you are unsure which framework applies, or both, apply the stricter standard and consult your supervisor. Section 6, HIPAA and 42 CFR Part 2 in daily PHSNC practice. Let's talk about what these frameworks mean in your actual day-to-day work at PHSNC. When you answer a phone call from someone asking about a client, you must first verify that a valid authorization or consent is on file before sharing any information. It does not matter if the caller claims to be a family member, a case manager at another agency, or even another healthcare provider. Without proper authorization or legal exception, you do not confirm or deny that a person is even a client here. When you document in the clinical record, remember that your notes are PHI. Be accurate. Be professional. Document only what is relevant and necessary for care. Avoid including information that could expose the client to additional risk if the record were ever disclosed, such as immigration status or legal matters that are not directly related to treatment. When you communicate by email or text, use only PHSNC-approved encrypted platforms. Never send client-identified information through personal email or unsecured text messages. Verify that any electronic communication platform you use has been approved by PHSNC leadership. When you discuss a client with a colleague, do so in a private space, not in hallways, waiting rooms, elevators, or shared spaces where others could overhear. Even well-intentioned conversations can become HIPAA violations if they occur where unauthorized individuals can hear them. When a client or authorized party requests access to records, follow PHSNC's records request policy. Clients have the right to access their own records under HIPAA. That request must be handled through the proper process with appropriate timelines. Remember, your obligation to protect client information continues even after you leave PHSNC employment. HIPAA and 42 CFR Part 2 do not stop at the end of your last shift. Section 7, Breach of Confidentiality, what it is and what to do. A breach of PHI occurs when there is an unauthorized acquisition, access, use, or disclosure of PHI that compromises the security or privacy of that information. Under HIPAA, a breach is presumed reportable unless PHSNC can demonstrate through a formal risk assessment that there is a low probability the PHI was compromised. Breaches can happen in many ways. A staff member accidentally emails a client record to the wrong person. A laptop containing client information is left unattended in a car and stolen. A paper record is left visible on a desk in a shared workspace. A staff member accesses a client's record without a legitimate treatment reason. If you believe a breach has occurred or may have occurred, you must report it immediately to your supervisor and to PHSNC's designated privacy officer. Do not wait. Do not try to handle it on your own. time matters in breach response. PHSNC will conduct a breach risk assessment. If the breach meets the threshold for notification, PHSNC is required to notify the affected individual, the Department of Health and Human Services, and in some cases, the media. The consequences of a breach can include regulatory penalties, legal liability, and most importantly, harm to the client we failed to protect. The best way to prevent a breach is to follow the policies and procedures PHSNC has put in place. Use only authorized systems. Lock your workstation when you step away. Dispose of PHI through shredding or other secure destruction. And speak up if you see practices that could put client information at risk. Section 8, Scenario-Based Reflection. What would you do? Let's apply what we have covered so far. Take a moment to think through each of these scenarios. These are fictional examples for training purposes only. Scenario 1. A staff member receives a phone call from a man who says he is the adult brother of a current PHSNC client. He says the client gave him permission to call, and he just needs to know if his sibling attended their last appointment. The staff member knows the client and knows the brother is supportive. What should the staff member do? Pause here and reflect before continuing. The correct response is, the staff member cannot confirm or deny any information about the client without a valid, signed authorization on file, specifically authorizing disclosure to this individual. Good intentions do not override HIPAA. The staff member should ask the caller to have the client submit a written authorization and document that the call occurred. Scenario 2. A peer support specialist is helping a client navigate housing services. The housing agency asks the peer specialist to email a copy of the client's treatment summary so they can process the application faster. The peer specialist wants to help and feels the request makes sense. What should the peer specialist do? Pause and reflect. The correct response is, the peer specialist must verify whether a signed authorization is on file that specifically authorizes disclosure to that housing agency for that specific purpose. If not, the peer specialist cannot send the record. The peer specialist should work with the supervisor and obtain proper authorization before sharing any information. And if the records involve substance use disorder treatment, 42 CFR Part 2 consent requirements also apply. Scenario 3. A clinician overhears two administrative staff members discussing a client's recent hospitalization in the hallway while waiting for the elevator. Other clients and visitors are nearby. What should happen next? Pause and reflect. The appropriate response is, this is a potential HIPAA violation. The clinician should respectfully interrupt the conversation, ask the staff members to move to a private area, and report the incident to a supervisor. The staff members should be reminded of the privacy standards and the importance of protecting conversations about clients. Section 9, Key Compliance Reminders. Before we close Part 1, here are your key compliance reminders. These apply to every PHSNC staff member in every role. Reminder 1 is any individually identifiable health information. Protect it at all times, in speech, in writing, and in digital communications. Reminder 2, apply the minimum necessary standard in every access, use, and disclosure of client information. Reminder 3, obtain written authorization before disclosing PHI for purposes outside of treatment, payment, and operations. Reminder 4, 42 CFR Part 2 provides additional protections for substance use disorder records. Know when it applies and follow the stricter standard. Reminder 5, the prohibition on redisclosure is mandatory. Include the required statement with every 42 CFR Part 2 disclosure. Reminder 6, report suspected breaches immediately to your supervisor and to PHSNC's privacy officer. Do not delay. Reminder 7, when in doubt, stop and ask your supervisor. Following PHSNC policy, supervisor guidance, applicable law, payer requirements, and documentation standards is not optional. It is the foundation of ethical, legal practice. Section 10, Knowledge Check. Before we close, take a moment to consider these knowledge check questions. These are for your personal reflection. Your supervisor or training coordinator may use these in a group discussion or follow-up activity. Question 1. What does PI stand for and what types of information does it include? Question 2. What is the minimum necessary standard? And can you give one example of how it applies in your role at PHSNC? Question 3. What makes 42 CFR Part 2 different from standard HIPAA when it comes to substance use disorder records? Question 4. What must you include with every disclosure of 42 CFR Part 2 records and why? Question 5. If you suspect a breach of client information has occurred, what are your first 2 steps? Closing, connecting privacy to our mission. As we close Part 1, let's come back to why all of this matters. At PHSNC, we believe that every person who walks through our doors or calls our line or meets with a peer specialist in the community deserves to be treated with dignity, respect, and care. Protecting their information is not just a legal obligation. It is an act of compassion. It is a statement that says, we see you, we honor you, we will keep your trust. Our mission is to empower individuals and families to achieve stability, independence, recovery, and meaningful quality of life. That mission is only possible when people trust us, and trust begins with confidentiality. Our vision is to build stronger families and healthier communities by meeting individuals where they are. When a person seeks behavioral health services, especially for substance use disorder, they are making a courageous choice. Your commitment to HIPAA and 42 CFR Part 2 protects that choice. It keeps the door open for recovery, helping you live your dreams every day. That is the promise of PHSNC. And every time you protect a client's privacy, you are living that promise. Thank you for completing Part 1 of the PHSNC Staff Training Series. Please proceed to Part 2, Client Rights, and continue building the knowledge that makes you an exceptional member of the PHSNC team.